So now for the last bit, I just want to talk briefly about COVID. I'm bringing you forward to the 8th of March, 2020, my son's birthday. And I had COVID. I must have been one of the first GPs to have COVID. The first cases were about January that year. And I realized that I was literally learning about the disease at the same time as everyone else was. And all of us were learning about the disease. I developed a cough and it was dry, and it was less when I lay on my front. And now we have proning, or lying on your front if you're on ITU. I lost my sense of taste. I couldn't taste coffee. And I was absolutely tired. I was asleep almost all the day, just got up for food and so forth. That was for 3 weeks. My wife is a physiotherapist and had read about the fact that oxygen tends to dip in the blood. So we got some oximeters out, and I didn't dip below that crucial 95% oxygen saturation level. And despite some very odd rashes, I managed to stay out of hospital. But after that illness, I realized that the importance of oxygen monitoring, and we persuaded the CCG, the Clinical Commissioning Group, to get oxygen saturation monitors for every surgery in Hampshire. And that helped GPs manage the care, and yourselves as patients and ourselves as patients manage our own illness. That, we think, made a big difference, and it led on to virtual wards where remote monitoring of people at home was taking place using oxygen saturation monitors that were delivered to their house. You'll see my nails there, and you can just about make a line across those nails. They're called Bowes lines, and they occur when somebody's been through an illness, in the same way that you might lose your hair when you've been through an illness. I was asked before I did this talk, how about reception team and the staff? Well, they were really under pressure. Not only were they under pressure from the day-to-day work and changing the system, but they were under pressure from the risk of illness. And we were all under pressure. We were all handling the unknown. For a male nurse in our surgery, the risk of them getting COVID was 4.5 times the national average. And for those working in social care at the nursing homes, their risk was extremely high as well. Amongst the GPs who died, most of them were BAME, Black and minority ethnic. I was lucky. The next slide. The surgery seemed to change every week after I got back after that COVID infection. And first of all, the chairs became separated, and then the chairs stopped. Then we had social distancing. We had markers there. We had barriers in front of reception. We've had plastic screens up. We've got masks, gowns, gloves. It's all changing. Next slide. Come forward to 2021. We really appreciated the clapping. It's great. And all the thank you messages and notes that you remember out there. This is somebody's wall in Hamble with a rainbow painted on it. I was involved with a video in New Zealand looking at COVID and how we tackled COVID. There's been some 17 million cases of COVID in the UK up to now. 158,000 people, sadly, have died, and that's 5.7 million worldwide. We've got people who have long COVID, 1.3 million. And we are doing a study as a surgery on long COVID and how a little bit of movement every half hour might help people recover from long COVID. That study is going on now. We're going to be recruiting in the next few months. Next slide. This is me in a garden consultation, and we brought our own chairs. We did the consultations through the window or through the patio when we were doing home visits. We wore scrubs, and again, if we're seeing people and examining them, we'd have gloves and masks and gowns on. We had hot sites and cold sites. The hot blue on the right. St. Francis and Park were cold sites. The hot site, one was in Romsey, and we used to go along and see patients there. In this last year, we've had 375 million appointments in the UK. That's the highest ever. It's something like 15 to 30% increase in appointments, 15 to 20% over. And that's about 6 appointments a person. I'm not sure many of you would have had 6 appointments, but just think about it. Next slide. Oh, next picture shows me having vaccines. And of course, vaccination has made the big difference. On the next slide, you'll see a poem. And I'm going to read it out if I can find it here. About the choice of vaccines. A fortunate vaccine, VEX, in 2021. It was Pfizer versus Oxford AstraZeneca back then. Some thought they had a choice somehow. Others had to take first come, first serve. The decision was no sum. It seems the choice, if given, was not so clear. mRNA from 1990s studies was now here, but viral injected DNA had been around for years. Decision-making and false news just stoked up all the fears. But remember how fortunate we all were, as vaccines cure and hold the COVID exit door ajar. A miracle of science to smallpox Jenner we owe, a glimpse of light above in the COVID dark tunnel below. The solution I suggest for you and me is much easier, as you will see. P for Pfizer is at the middle, and A or Z for AstraZeneca is at the ends of the English alphabet. So just go with what you're given and accept is what you get. And we've been so lucky to have those vaccines and to get to our third booster and to be protected. We have the only people on ITU really are those intensive care units, are those people who haven't had the vaccinations. Which leads me to the next slide, and the yellow placards that you may have seen around. Now, I saw these in Liverpool when we were presenting some of the research that we've done as a practice at a conference there. And the first one says, can we trust the media? Well, that sort of draws you in because we all think, oh, can we? But about the fifth or sixth one in of these placards was talking about the number of deaths from COVID vaccination. Now, we've had no deaths in our surgery. And we have 17,000 patients. We've had no serious reactions in our surgery. And I went up to these anti-vaxxers and I said to them, if you haven't had the vaccine, you really need to be at home. You're in the middle of a pandemic, you should be isolating. And they thought about it, and I think they got the message in the end. But it's very difficult. And I really want to encourage them. And anyone who hasn't had your vaccination, come and get one. It's well worth it. It'll make a difference to your life, I tell you. And the last slide, I think, February 2020. We're here now. We've had a journey in history from 1897. And I can say, with hand on heart, that we have better care. I see less heart attacks, I see less strokes, I see less severe rheumatoid arthritis, I see less chronic conditions. That's really good. I see more care is provided within general practice. Something like 92% of healthcare takes place in general practice, and we have something like 9% of the budget or less for general practice. And we have a much wider team. So I hope I can be positive in February 2022. It is difficult still to get appointments, but there's more of them. So I can't quite understand that. We are working on it. And I just want to thank you very much indeed, next slide, for listening and for being part of the PPG and part of our patient population and all that we've achieved over these 30 years and many years since Dr. Ritchie. Thank you very much indeed.